Hello and welcome to the second lecture of PYQ series for Obstetric and Gynecology students who are preparing for PDCET Obs-Gyne exam. You can subscribe this channel for more such videos. So without wasting any time, we will quickly go through few questions which have been previously asked in exams. So question number 1, which of the following is not true about obstetric conjugate? Now it's my advice that how you should go through these questions. Which of the question is of this format, like not true or accept, then you should try to learn all the options which are correct. So this will cover that particular topic. So now the question is, which of the following is not true about the obstetric conjugate? So distance, so first go through all the options. Distance between midpoint of sacral promontory to prominent bony projections at the midline of the inner surface of symphysis pubis. The smallest AP diameter of pelvic inlet, diameter is 9.5 centimeter, and it is the diameter through which fetus must pass. So examiners asked that which of the following option is not correct about obstetric conjugate. So answer of this is answer C, that is the diameter is 9.5 centimeter. This is not correct. So first of all, you learn all these three options so that a few important points about this obstetric conjugate will be remembered, and then the correct answer is diameter of obstetric conjugate is 10 to 10.5 centimeters. So it is given 9, so that is wrong option. Next question, C-section is mandatory in which presentation? So in which presentation C-section is mandatory? Cephalic, face, vertex or bro? So just try to guess answer in your mind. So answer is D. It is in bro presentation, engaging diameter is 14 centimeter and 14 centimeter cannot pass through cervix. So hence C-section is mandatory in bro presentation. You can remember BC in bro presentation and C-section is necessary. So question third, the quantity of hormone released by progesterone per day is 25 microgram, 45, 65 or 85. So the correct answer is C, that is 65 microgram. So also remember the unit, 65 microgram progesterone per day is released. Okay. So next is tumor secreting placental alkaline phosphatase. Placental alkaline phosphatase is secreted by which tumor? Carcinoid tumor, adenoblastoma, granulosa cell tumor or dysgerminoma. So correct answer is D, that is dysgerminoma. So dysgerminoma corresponds to seminoma of the testes. This is an important point. This can be asked as an MCQ. It is usually seen in young women or children. It secretes placental alkaline phosphatase. It does not secrete male or female sex hormones. So question can be formed about dysgerminoma. Which of the following is not true about dysgerminoma? And options can be made from these points. So try to go through these lectures in this way. Next question, solid tumor with cystic area in between filled with hemorrhagic fluid, accounting for about 20% of all ovarian cancers. So what are the important points in this question? Solid tumor, cystic areas, filled with hemorrhagic fluid, and about 20% of all ovarian cancer. So options are cystadenocarcinoma, mesonephroid tumors, endometrioid tumors or Brenner tumor. Correct answer is C, that is endometrioid tumor. So for endometrioid tumor, you should remember these points. This tumor is solid, cystic areas is present and filled with hemorrhagic fluid, and it accounts for around 20% ovarian cancer. Now, how indirect questions are framed from previous year question, you can understand by this example that question can be framed that endometrium tumor or endometrioid tumor comprises almost how much percentage of total ovarian cancers. So if they give options 10, 20, 30, 40, so you should choose 20. So indirect questions can be formed. It's not necessary that exact line to line same questions will be repeated every year, but the purpose of doing previous year questions is that indirect questions are formed in any manner. Now next is Moskowitz repair is done for a single liner. Question, Moskowitz repair is a type of procedure or surgery done for wall prolapse, enterocele, chronic invasion of uterus, adenomyosis. So always guess the answer before going to the next slide. So answer is B, that is enterocele. So remember these one-liners are also very much important. Next is, which is true regarding Savage syndrome? Few points about Savage syndrome. They have asked the correct option. So receptor defect to gonadotropic hormones, short stature, ovaries do not contain follicles, and FSH is normal. So which of the following is true? A option is true. That is, what is Savage syndrome? Receptor defect to gonadotropic hormones. This is Savage syndrome. Absence of corkscrew glands. Absence of corkscrew glands is seen in Halbin's disease, polycystic ovarian disease, irregular ripening or metropathia hemorrhagica. So answer is D, that is metropathia hemorrhagica So question can be framed in this way, that metropedia, which of the following is a feature of metropedia hemorrhagica, and if one of the options comes that absence of corpuscular gland, then you have to choose that option as the correct answer. Okay, so these previous year questions you should master. Our first target should be to master these questions, so that you should score at least 90 to 95% correct in these previous year questions, direct as well as indirect questions. Next is false regarding hormone levels in polycystic ovarian disease. This is important topic, PCOD and changes in hormonal levels in PCOD. So options are, they have asked false. So increase androgen, increase prolactin, increase LH, increase LH-FSH ratio. So answer is B, that is increased prolactin is false. So we will just go through shortly. In PCOD what happens? Increase androgen, increase estrogen, increase LH, decreased FSH, and increase LH-FSH ratio is more than 2, and increase insulin. So remember these questions have been asked many times from this topic. Next is, a 13-year-old girl came to casualty with acute lower abdominal pain. She had cyclical pain for last 6 months. She has not yet attained her menarche. On examination, a tense bulge was seen in the region of the hymen. The most probable diagnosis is MRKH syndrome, imperforate hymen, Escherman syndrome, or congenital adrenal hyperplasia. So the answer is B, that is imperforate hymen. So what all important points? 13-year girl, acute lower abdominal pain, cyclical pain for 6 months, not cyclical pains for 6 months and not yet attained menarche, and tense bulge was seen in the region of the hymen. So imperforate hymen, it prevents the drainage of menstrual blood. This results in accumulation of blood in the vagina leading to hematocolpos, and this is visualized as tense bulge, and tense bulge was given in question. In long standing cases it can even lead to hematometra. Next is, weight gain in pregnancy depends on all except. So smoking, pre-pregnancy weight, ethnicity, and maternal age. So answer is A, weight gain in pregnancy does not depend on smoking, it depends on pre-pregnancy weight, ethnicity, maternal age. Now, drug of choice for treatment of intrahepatic cholestasis of pregnancy: ursodeoxycholic acid, dexamethasone, antihistamines, and cholestyramine. So question on intrahepatic cholestasis of pregnancy, and drug of choice is ursodeoxycholic acid. Which of the following maneuvers is not used for the management of shoulder dystocia? Now, not use shoulder dystocia maneuvers. So McRoberts maneuver, suprapubic pressure, wood screw, corkscrew maneuver, and Mauricio Smelly Wheat maneuver. So answer is D. So this is not used in shoulder dystocia. So you should remember from this question that these three are used in shoulder dystocia. So this is the way how you try to gain as much as possible from previous year questions. Question 14. The most common pure germ cell tumor of the ovary is choriocarcinoma, dysgerminoma, embryonal cell tumor, and malignant teratoma. Answer is B. The most common pure germ cell tumor of ovary is dysgerminoma. Most common pure germ cell tumor ovary. So dysgerminoma is the correct answer. Now all of the following appear to decrease hot flushes in menopausal women except. Another question with except: androgens, raloxifene, isoflavones, and tibolone. So raloxifene is the answer here. It does not decrease hot flushes in menopausal women. So few points about the raloxifene. Raloxifene is orally administered selective estrogen receptor modulators. It has estrogenic action on bone and anti-estrogenic action on uterus and breast. So these points can be framed as a question for raloxifene. It is used to prevent osteoporosis in postmenopausal women, not used for hot flushes. It is also protective against breast and endometrial cancer, and it is not useful in the treatment of hot flushes. Another question: use of one of the following vaccination is absolutely contraindicated in pregnancy. Which vaccine is absolutely contraindicated? Hepatitis B, cholera, rabies, yellow fever. Yellow fever vaccine is live attenuated vaccine, and live attenuated vaccines are absolutely contraindicated in pregnancy. Next is, infant of diabetic mother are likely to have which of the following cardiac anomaly? Coarctation of aorta, phyllotetralogy, Epstein anomaly, transposition of great arteries. So the most common is transposition of great arteries among these questions. So infant of diabetic mother, and which cardiac anomaly? So TGA is commonly seen. Next is, which of the following biochemical parameters is the most sensitive to detect open spina bifida? Maternal serum alpha fetoprotein, amniotic fluid alpha fetoprotein, amniotic fluid acetylcholinesterase, and amniotic fluid glucose hexaminase. So amniotic answer is C, that is amniotic fluid acetylcholinesterase is the biochemical parameter most sensitive to detect open spina bifida. Next question, which vitamin deficiency is most commonly seen in a pregnant mother who is on phenytoin therapy for epilepsy? Suppose a mother is on phenytoin for epilepsy treatment, which of the following deficiencies most commonly seen? It is folic acid. And about folic acid absorption is decreased and its excretion is increased in those patients who are on phenytoin. Another deficiency seen in phenytoin users are vitamin D, K. Hence, pregnant women on phenytoin should take folic acid, cholecalciferol, and phytonadione supplements for vitamin K. Last question of this session, question 20. Which of the following tumor is not commonly known to increase in pregnancy? So, pregnancy increases risk of certain tumors. So, which of the following is not risk is not increase in pregnancy? Glioma, pituitary adenoma, meningioma, neurofibroma. So, answer for this is glioma. The risk of glioma is not increase in pregnancy. So, remember this: tumors which increase in size during pregnancy: pituitary adenoma, neurofibroma, meningioma, and angioma. Thank you very much for your patience, and you can subscribe channel for more upcoming videos in next few days. And I just advise you guys that if you are not getting much time to read, then these previous year questions are very important, because any exam, most of the at least 50 to 60% of questions are indirectly or directly from previous year. And I have told you how to go through these questions in an indirect manner. That is, you should try to evaluate about all the options and try to remember all the options, so that any indirect question framed from such topic and you will be able to answer in exams. Okay, thank you. So please share this video and this channel with your colleagues or friends who are preparing for PDCET Obs Gynae. Thank you.